For pet owners, it's one of the toughest decisions you ever have to make. When is the right time to send your dog or your cat to the other side of the Rainbow Bridge? Did you know there's a service that actually makes house calls to help your family during those critical moments? Right now, we're joined by Dr. Emily Plock. She's a veterinarian with Lap of Love in Southeast Michigan. Thanks for being here, number one. Is your entire veterinary care mobile, by the way?
Yes, so all of the vets with Lap of Love, we operate out of our homes. And the service area in the Southeast Michigan area, it's like a 30-mile radius from downtown Detroit. So I've got
a wide area.
Very wide. We help so many families. I've gone as far north as Clarkston, and I've gone as far south as Monroe. So we, help a large service area, help so many families.
Was that always kind of your plan, or what kind of clicked and you thought, you know what, that's kind of a niche area to just be completely mobile when it comes to that?
Yeah, and when I graduated vet school, if you would have told me I was providing end-of-life care full-time, I would have been like, there's no way. But as I was in general practice, I saw a need for these pets to, have a peaceful and dignified passing.
Yeah.
And at the clinic, it's so stressful. A lot of times they've been sick. The visits are stressful, the sounds, the smells. Being able to do it at home where they're the most comfortable has, comparing the two, it's so much more peaceful at home for them. It's incredible.
As a dog owner, that makes complete sense. Talk to me about costs. Because people know what it's like to go to the vet and what that bill is going to be. How does it differ when it's mobile?
Yeah, and so the cost varies on, different factors, depending on drive time, if it happens on the weekend. So there's a lot of factors that go into the cost. I will say, comparing it to general practice, it's going to be a little bit more expensive. But if the family's interested in pursuing, in-home euthanasia or hospice or telehospice, give our team a call and we can get you a more detailed estimate on what that would look like.
What have you heard from customers, patients, when they're able to stay home, and it's kind of those moments where when you do have to go to the office, not the whole family can go in those moments?
Absolutely. And a lot of people choose to have it at home so that way their other pets can be present too. Most families have more than one dog, more than one cat, and so having to bring all your pets to the clinic and stress them out too, it provides you a way to have everybody at home with them. And I have so many families tell me that this is so much better to be able to do it at home versus, stress them out in the car, take them to the clinic. And it's not only less stressful for the pet, but for the family as well. You're in the comfort and privacy of your home, and you can, be as emotional as you need to.
I've done stories on hospice nurses for humans and the stress they go through and kind of the burden they carry. It's tough. What is it like for what you guys do?
Yeah, and it's very similar. I have so many people tell me, how do you do this? Your job must be terrible, and it's sad, but I think it's so rewarding to be able to help families in this time. I think it's the most important time. And so, taking time to take care of myself is important because it is more emotional. But like I said, I find this very rewarding. I think this is the niche of medicine that I was meant to find. And so I love what I do. It sounds a little weird to say that you love that, but I do.
Pet owners understand. Dr. Plock, thanks so much for coming in. It's called Lap of Love. Check it out if you're thinking about the end stage for your pet at home. Thanks so much for being here.
Thank you for having me.
We'll be right back.